Diabetes is often called a silent killer, a condition that can strike without warning until it's too late. Many diabetes sufferers don't realize they have this disease until serious complications begin to appear, changing their lives forever. Before we begin, write in the comments section whether you have a family history of diabetes, and whether you have had your blood sugar checked in the last 6 months. Imagine our body as a complex machine that needs fuel to function. Glucose is the main fuel for our cells, providing the energy we need to function every day. However, when diabetes strikes, this fuel processing system is disrupted, creating dangerous metabolic chaos. If not detected and managed properly, diabetes can cause damage to the heart, blood vessels, eyes, kidneys, and nerves. The good news is that by recognizing early signs, we can take action before it develops into more serious health problems. Let's discuss the various types of diabetes, early symptoms to watch out for, and preventive measures that can be taken to protect our health. This knowledge could be the difference between living healthily or facing serious complications in the future. Types of diabetes. 1. Type 1 diabetes. Type 1 diabetes, formerly known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition where the pancreas produces little or no insulin at all. This disease typically develops rapidly, often in childhood or adolescence, although it can also appear in adulthood. Insulin is an essential hormone that allows glucose to enter cells to produce energy. Without insulin, glucose accumulates in the bloodstream, causing dangerous high blood sugar levels. Think of insulin as a key that unlocks cell doors, allowing glucose to enter and be used as fuel. The exact cause of type 1 diabetes is still not fully known, but experts believe the condition is a combination of genetic vulnerability and environmental factors that trigger an immune system attack against the insulin-producing beta cells of the pancreas. In this case, the immune system mistakenly recognizes healthy cells as intruders and destroys them. The impact of type 1 diabetes can be very serious if not properly managed. Without insulin, the body's cells starve for energy, even though glucose is abundant in the blood. Long-term complications include blood vessel damage, blindness, kidney failure, nerve damage, and increased risk of heart disease and stroke. Managing type 1 diabetes requires lifelong insulin therapy, either through injections or insulin pumps. Sufferers also need to monitor their blood sugar levels regularly, regulate their diet, and maintain an active lifestyle. With proper management, people with type 1 diabetes can live long and healthy lives, preventing or slowing the development of complications. 2. Type 2 diabetes. Type 2 diabetes is the most common form of diabetes, accounting for about 90% of all diabetes cases worldwide. Unlike type 1, type 2 diabetes develops slowly, often without clear symptoms in the early stages, making it difficult to detect without routine checkups. In type 2 diabetes, the body develops resistance to the effects of insulin, or does not produce enough insulin to maintain normal glucose levels. It's like a key, insulin, that no longer fits the lock, cell receptors, or the number of keys available is not enough to open all the necessary doors. The main risk factors for type 2 diabetes include obesity, inactive lifestyle, unhealthy diet, family history of diabetes, and increasing age. Although once considered adult-onset diabetes, the number of children and adolescents diagnosed with type 2 diabetes continues to increase, in line with rising obesity rates in this age group. Without proper management, type 2 diabetes can cause the same serious complications as type 1 diabetes, including heart disease, stroke, neuropathy, nerve damage, retinopathy, eye damage, nephropathy, kidney damage, and increased risk of infections. Its impact on quality of life and life expectancy can be very significant. The good news is that, unlike type 1 diabetes, type 2 diabetes can often be managed, controlled, and even reversed with lifestyle changes, especially in the early stages. Weight reduction, regular physical activity, and a healthy diet can significantly improve the body's ability to manage blood sugar. If lifestyle changes alone are not enough, doctors may prescribe oral medication or insulin therapy. 3. Gestational diabetes. Gestational diabetes occurs during pregnancy when hormonal changes result in the body being unable to use insulin effectively, causing glucose levels to rise. This condition usually appears in the second or third trimester of pregnancy and affects about 2 to 10% of pregnancies each year. During pregnancy, the placenta produces hormones that make cells less sensitive to insulin, creating physiological insulin resistance to ensure enough glucose is available for fetal development. In most women, the pancreas increases insulin production to overcome this resistance, but in some women, the pancreas cannot meet the increased demand, causing gestational diabetes. Risk factors for gestational diabetes include being overweight before pregnancy, family history of diabetes, age over 25, and certain ethnicities. Women who have experienced gestational diabetes in a previous pregnancy also have a higher risk of developing it again. Without proper management, gestational diabetes can cause complications for both mother and baby, including babies with excessive birth weight, macrosomia, neonatal hypoglycemia, low blood sugar in newborns, and increased risk of cesarean section. Women with gestational diabetes also have a higher risk of developing type 2 diabetes later in life, while their children may have a higher risk of obesity and type 2 diabetes. Managing gestational diabetes involves regular blood sugar monitoring, adopting a healthy diet, and exercising regularly. In some cases, insulin therapy may be needed to maintain blood sugar levels in a healthy range. Gestational diabetes usually disappears after delivery, but it's important to continue monitoring blood sugar levels after childbirth because of the increased risk of type 2 diabetes in the future. Signs and symptoms of diabetes. Recognizing the early signs of diabetes is crucial to prevent the development of serious complications. Although some symptoms may seem mild or common, when they appear together and persist for several weeks, it's time to consult with a healthcare provider. 1. Frequent urination and excessive thirst. Frequent urination, polyuria, and unusual thirst, polydipsia, are classic signs of diabetes that often appear together. Imagine this as an interconnected cycle, starting when blood sugar levels are high. When too much glucose accumulates in the bloodstream, the kidneys work hard to filter this excess. Normally, kidneys reabsorb glucose while filtering blood, but when there is too much glucose, the kidneys cannot keep up, causing some glucose to exit through urine. This glucose draws more water with it, increasing urine volume and causing more frequent urination. The domino effect is that the body loses more fluid, causing dehydration and triggering an intense thirst. Someone with diabetes may find themselves waking up several times at night to urinate and then drinking lots of fluids because of thirst. The impact of this cycle can be significant if not addressed. Chronic dehydration can cause fatigue, headaches, dry skin, and even long-term kidney problems. For people with type 1 diabetes, these symptoms often appear quickly and intensely, while in type 2 diabetes, the development may be more gradual and less obvious. If you experience increased frequency of urination and unusual thirst, it's important to monitor these symptoms and note when they occur. Drinking more water is a natural response to thirst, but if this cycle continues despite adequate hydration, it's a sign to immediately consult with a doctor and have your blood sugar checked. 2. Extreme hunger and unexplained weight loss. Extreme hunger, polyphagia, along with unexplained weight loss is a combination of symptoms that seem contradictory yet are highly indicative of diabetes. This phenomenon occurs due to disruptions in how the body processes energy from food. Under normal conditions, insulin carries glucose from the blood into the body cells, where glucose is converted into energy. However, in diabetes, due to insulin deficiency or insulin resistance, glucose cannot enter cells efficiently. As a result, although the blood is filled with glucose, the body cells are starving for energy. The body responds by sending hunger signals, urging a person to eat more in an attempt to fill the cellular energy deficit. However, eating more does not solve the problem because glucose still cannot enter cells without properly functioning insulin. Simultaneously, because cells are not getting the energy they need from glucose, the body begins to break down fat and muscle tissue as alternative energy sources, causing weight loss despite increased calorie intake. This weight loss can be significant and occur in a short time, especially in type 1 diabetes. The long-term impact of this condition extends beyond the discomfort of constant hunger and weight loss. Fat breakdown produces ketones, which can accumulate in the blood to dangerous levels, ketoacidosis, especially in type 1 diabetes, causing potentially life-threatening metabolic disturbances. If you experience a significant increase in appetite along with unexplained weight loss, especially if accompanied by other symptoms such as frequent urination and excessive thirst, Seek medical help immediately. A simple blood sugar test can provide a diagnosis and allow proper management to correct this metabolic imbalance. 3. Fatigue and irritability. Persistent fatigue and mood changes, such as irritability, are diabetes symptoms often overlooked because of their common nature and could be associated with many other conditions or even just everyday life stress. However, in the context of diabetes, these symptoms have a clear physiological basis. Fatigue occurs due to energy deficiency at the cellular level. When insulin doesn't function properly, cells don't get the glucose they need, leaving the body lacking fuel. This is similar to trying to run a vehicle with an almost empty fuel tank. The engine keeps running but with greatly reduced performance. At the same time, blood sugar fluctuations can affect brain function and neurochemical balance, causing mood changes. When blood sugar levels are too high or too low, the brain doesn't get the stable energy it needs, resulting in irritability, difficulty concentrating, and even confusion. The impact of fatigue and mood changes on quality of life can be significant. Productivity at work or school may decline, relationships become strained, and activities that are usually enjoyable become exhausting. For many people with undiagnosed diabetes, this chronic fatigue is often considered a normal part of aging or busy life. If you experience unusual fatigue that doesn't improve with adequate rest, or find yourself more irritable without clear reason, consider checking your blood sugar, especially if there are other diabetes risk factors. Managing blood sugar levels properly can dramatically improve energy levels and mood stability, restoring vitality and emotional balance. 4. Blurred vision. Blurred vision is an often overlooked but very important symptom of diabetes, which can appear both in the early stages and as a long-term complication. This phenomenon shows how diabetes affects even parts of the body that seem unrelated to glucose metabolism. Short-term blurred vision in diabetes occurs when blood sugar levels fluctuate rapidly. As blood sugar levels rise, fluid can be drawn from various tissues, including the eye lens. This changes the shape of the lens, affecting its ability to focus properly and resulting in blurred vision. Imagine a camera lens that changes shape slightly. The resulting photo will be less sharp. The same thing happens to the eye when high blood sugar changes the fluid balance. When blood sugar levels return to normal, vision usually also returns to normal. However, blurred vision can also be a sign of serious long-term eye complications such as diabetic retinopathy, where blood vessels in the retina are damaged by prolonged high blood sugar levels. This is a leading cause of blindness in working-age adults and develops silently for years before symptoms become apparent. The impact of vision disturbances on quality of life is very significant, affecting the ability to drive, read, work with computers, and enjoy visual activities. In severe cases, diabetic retinopathy can cause permanent vision loss if untreated. If you experience sudden or gradual vision changes, don't ignore them. Immediately consult with a doctor for blood sugar testing and potential referral to an eye doctor. Annual eye exams are very important for people with diabetes, as early detection of diabetic retinopathy allows treatment that can prevent or slow further damage to vision. 5. Slow wound healing. Slow wound healing or frequent infections are often overlooked but very important signs of diabetes, especially in long-standing type 2 diabetes. These symptoms reflect the widespread impact of high blood sugar on the immune system and vascular function. At the physiological level, high blood sugar damages blood vessels and nerves, disrupting normal blood flow to injured areas. Healthy blood flow is essential for wound healing, carrying needed oxygen and nutrients as well as immune cells to fight infection. Additionally, immune function is impaired in uncontrolled diabetes, reducing the body's ability to deal with bacteria and other pathogens. High blood sugar levels also create an environment that supports the growth of certain bacteria and fungi, increasing the risk of infection. The impact of these symptoms can be serious and even life-threatening. Wounds that seem small, such as blisters or scratches, can develop into chronic ulcers that are difficult to heal. In severe cases, especially on the feet, diabetic foot ulcers, infection can spread to the bone, osteomyelitis, and may require amputation. Diabetes is a leading cause of non-traumatic amputation in many countries. If you notice wounds healing slower than usual, especially on the feet, or experience frequent or prolonged infections, consult with a healthcare provider immediately. Good blood sugar management, proper wound care, and regular foot examinations can significantly reduce the risk of serious complications. In diabetes, Even small problems with the feet should not be ignored and should be addressed by healthcare professionals. 6. Fungal infections and skin problems. Recurrent fungal infections and skin problems are often overlooked but very informative indicators of diabetes. These symptoms can be early warning signs, especially in individuals with undiagnosed or poorly controlled type 2 diabetes. The main cause of increased fungal infections in diabetics is high sugar levels in body tissues and fluids. Fungi, especially Candida albicans, thrive in sugar-rich environments. Imagine sugar in the body as fertilizer that accelerates fungal growth. High glucose levels create a perfect habitat for fungal proliferation. Fungal infections in diabetics most commonly occur in warm, moist areas such as the mouth, oral thrush, skin folds, intertrigo, under the breasts, in the groin, and genital areas. In women, recurrent vaginal yeast infections can be a sign of undiagnosed diabetes. In men, fungal infections of the penis, balanitis, can also occur. Besides fungal infections, diabetes can cause various other skin conditions. Acanthosis nigricans, thickening and darkening of skin in neck folds, armpits, or groin, is strongly associated with insulin resistance. Diabetic dermopathy, brownish patches on the skin of the feet, and necrobiosis lipoidica, areas of thinning skin with a reddish-brown color, are also more common in diabetics. The impact of recurrent fungal infections and skin problems is more than just physical discomfort. They can cause embarrassment, anxiety, and withdrawal from social activities, affecting overall quality of life. Untreated infections can spread and become more serious, especially in individuals with compromised immune systems. If you experience recurring fungal infections or ones that appear without clear reason, or notice unusual skin changes, consider checking your blood sugar. Effective blood sugar level management is often the key to reducing the frequency and severity of fungal infections. Maintaining cleanliness, drying moist areas well after bathing, and wearing loose clothing made from breathable materials can also help prevent fungal infections in diabetics. Prevention and management of diabetes. Although diabetes can be a serious disease, many cases of type 2 diabetes can be prevented or delayed with appropriate lifestyle changes. Even those already diagnosed can significantly reduce the risk of complications through effective management. 1. Maintaining a healthy weight. Maintaining an ideal weight is one of the most effective strategies for preventing type 2 diabetes. Research shows that each kilogram of weight loss can reduce the risk of diabetes by up to 16%, making weight management a key component in prevention strategies. Excess weight, especially obesity, increases the risk of diabetes because fat cells, particularly visceral fat that accumulates around abdominal organs, are more resistant to insulin compared to muscle tissue. Fat cells also release inflammatory cytokines that can disrupt insulin signaling, worsening insulin resistance. Even moderate weight loss of 5 to 10% of initial body weight can provide significant benefits. This can be achieved through a combination of balanced diet and regular physical activity. A sustainable and gradual approach to weight loss is more effective than short-term strict diets, which often result in weight regain. The impact of obesity is not only limited to diabetes. Excess weight also increases the risk of heart disease, high blood pressure, sleep disorders, and many other chronic conditions. Conversely, achieving and maintaining a healthy weight improves energy, mood, and overall quality of life. For those struggling with weight, a comprehensive approach that includes professional support can be very helpful. Consult with a nutritionist to create a customized meal plan. Consider working with a fitness trainer to develop safe and effective exercise routines. And don't hesitate to seek psychological support to address emotional eating or other barriers. 2. Regular physical activity. Regular physical activity is an important pillar in the prevention and management of diabetes, with positive effects that extend beyond weight loss. Research shows that exercising at least 150 minutes per week can reduce the risk of diabetes by up to 58%, making it one of the most effective interventions. Exercise works on multiple levels to improve glucose metabolism. When we exercise, muscles take glucose from the blood for energy, lowering blood sugar levels. This happens regardless of insulin, providing a shortcut for glucose to enter cells. Additionally, regular activity increases the insulin sensitivity of our cells, making them more responsive to available insulin. The benefits of physical activity extend far beyond blood sugar control. Exercise strengthens the heart, lowers blood pressure, increases good cholesterol, HDL, levels, reduces stress, and improves mood through the release of endorphins. All these factors contribute to holistic health and reduce the risk of complications in those who have diabetes. Any type of physical activity is beneficial, not just structured exercise in the gymnasium. Brisk walking, swimming, cycling, and even gardening or active household chores can improve metabolic health. The key is finding activities that are enjoyed and can be maintained in the long term. For those just starting out, a gradual approach is essential. Begin with 5 to 10 minutes of light activity and gradually increase duration and intensity. Set specific and measurable goals, such as brisk walking for 30 minutes 5 times a week, rather than general goals like, be more active. If you already have diabetes, consult with a doctor before starting a new exercise program. They can provide recommendations based on your overall health condition and help prevent potential complications such as hypoglycemia, low blood sugar, during or after exercise. 3. Balanced diet. A balanced diet is a key component in the prevention and management of diabetes. Healthy eating habits can help control weight, stabilize blood sugar levels, and reduce the risk of diabetes-related complications. The impact of food on blood sugar levels varies depending on the type of carbohydrates, fiber content, and combination of foods consumed together. Processed carbohydrates such as white bread, white rice, and sweet foods are converted to glucose quickly, causing sharp spikes in blood sugar levels. In contrast, complex carbohydrates such as whole grains, legumes, and vegetables contain fiber that slows digestion and the release of glucose into the bloodstream. A diet that supports metabolic health doesn't have to be complicated or restrictive. The basic principles include consuming a variety of colorful vegetables, whole fruits, not juice, whole grains, lean proteins, and healthy fats. The Mediterranean diet, which is rich in plant foods, fish, olive oil, and nuts, has been shown to reduce the risk of diabetes and cardiovascular complications. Managing portion sizes is also important, even for healthy foods. Using smaller plates, eating slowly, and paying attention to the body's hunger and fullness cues can help prevent overeating. The simple plate method, filling half the plate with non-starchy vegetables, a quarter with lean protein, and a quarter with complex carbohydrates, provides an easy framework for composing balanced meals. Beverages also play an important role. Sweet drinks including soda, energy drinks, and even fruit juice contribute many calories without nutritional value and can cause significant blood sugar spikes. Plain water, unsweetened tea, and coffee, with minimal sugar and cream, are the best choices for regular hydration. Meal planning doesn't mean eliminating all favorite foods. An 80-20 approach, making healthy choices 80% of the time and simply enjoying special foods for the remaining 20%, can be more sustainable than strict restrictions. Working with a nutritionist can provide personalized guidance based on individual preferences, culture, and health goals. 4. Regular blood sugar monitoring. Regular blood sugar monitoring is an important practice in diabetes management and a valuable prevention strategy for those at high risk. It provides real-time insights into how food, activity, medications, and stress affect blood sugar levels, allowing for timely lifestyle adjustments. The process of blood sugar monitoring has evolved significantly in recent years. In addition to traditional finger prick methods, using test strips and glucometers, the latest technologies such as continuous glucose monitoring systems, CGM, provide continuous readings through a small sensor inserted under the skin. These innovations provide a more comprehensive picture of blood sugar patterns than point-in-time checks. The frequency of blood sugar monitoring varies based on the type of diabetes, treatment plan, and stability of blood sugar levels. People with type 1 diabetes and those using insulin often need to monitor several times a day, while those with well-controlled type 2 diabetes may only need to check a few times a week. However, more frequent monitoring is needed during illness, changes in activity, or medication adjustments. The impact of regular monitoring extends beyond the immediate response to individual readings. By tracking blood sugar levels over time, patterns and trends can be identified, providing valuable insights into the effectiveness of the overall management plan. This data can help healthcare providers adjust treatment and allow individuals to take greater responsibility for their health. For those at risk of diabetes, prediabetes, family history, or other risk factors, Annual blood sugar checks through fasting blood sugar tests or hemoglobin A1C tests are a wise practice. Early detection of prediabetes provides a window of opportunity to take preventive action, potentially delaying or preventing progression to type 2 diabetes. Effective monitoring involves more than just recording numbers. Knowing how to interpret readings and take appropriate action is essential. Working with healthcare providers to establish personalized blood sugar targets and develop action plans for readings outside these ranges empowers individuals to manage their condition with confidence. Conditions like diabetes may sound frightening, but with the right knowledge and proactive action, we can prevent or manage them effectively. The early signs we've discussed provide valuable opportunities for early intervention, while prevention and management strategies offer a path to a healthier life. If you feel the information in this video is helpful, don't forget to click like and share it with friends or family who might need it. Information about diabetes could be a lifesaver for someone who hasn't recognized the symptoms yet. Write your opinion in the comments section. Maybe there's an experience or question you'd like to share. And make sure to subscribe to the Seniors Insight channel so you don't miss other important health information that we will share regularly. Thank you for watching this video to the end. Remember, recognizing the early signs of diabetes and taking preventive action is the best investment for your long-term health. See you in the next video on the Seniors Insight channel, where we will continue to explore various health topics relevant to everyday life.